I think a lot of patients are concerned about whether or not getting an implant is going to be painful afterwards, whether or not they're going to experience discomfort. I'm still surprised at this, but after placing thousands of implants, patients report little or no pain after the placement of an implant. I usually tell them you experience more discomfort with the extraction of a tooth than you do with the placement of a dental implant. Fortunately, we rarely do have issues with the implants that we place. In a typical year, for every 100 or 150 implants that we place, one of them will not integrate. Usually this is due to infection. Fortunately, that's usually a very simple fix. We'll actually just remove the infected implant and just place a new one in the site after it's healed. And then very rarely, just like any procedure, things can happen. You can get inflammation around an implant, or there can be something that goes wrong. And fortunately, we have the ability to fix that in almost every situation. Dental implants are brushed and flossed just like your natural teeth. We currently do not think that there's any difference in the way that you would clean them or care for them. At this current point in time, an implant is treated just like a natural tooth.